Hi, I'm Jan Probst, Director of the South Carolina Rural Health Research Center. Our research center was founded back in 2000 by Dr. Mike Samuels and myself. Although Dr. Samuels has left us, we've been continuing his legacy. Our center was founded back in 2000 to address the problems of rural persons, particularly rural populations that are vulnerable because of minority race, ethnicity, or because of poverty and other factors that make it more difficult for such persons to get the health care they need and to maintain the health that they need. Since our founding, we have been privileged to work over the past 15 years with many of the best and brightest minds here at the University of South Carolina, both our wonderful faculty and, thankfully, more than 40 of our wonderful students who have had the opportunity to help serve their fellow citizens of South Carolina and rural residents all across the U.S. through participating in our research. We have been privileged here at the South Carolina Rural Health Research Center to work with about 40 wonderful students over our years of operation. Many of those students have gone on to great jobs where they can help people in different roles, either as hospital executives, as executives within state agencies affecting Medicaid or other aspects of public health, in federal agencies, in industry, and in other academic institutions. Some of these students have forwarded to us brief summaries of what they think they got out of their experience working at the South Carolina Rural Health Research Center.
Hi, I'm Bill Pearson. I work as a senior health scientist at the Centers for Disease Control and Prevention in Atlanta, Georgia. I'm also a 2004 graduate of the Arnold School of Public Health and received my doctorate in what used to be called the Department of Health Administration. While I was in school, Dr. Jan Probst hired me as a research associate at the South Carolina Rural Health Research Center. This was a really great opportunity for me in that it partially funded my education, but it also allowed me to take what I learned in the classroom and practice it in a real-world research setting. So I can say that the experience that I had at the Rural Health Research Center contributed to the success that I'm experiencing today in the work that I do at the CDC. Thank you very much for all that you did. Thank you, Dr. Probst, and thank you, South Carolina.
Hello, my name is Juanita Bowens, and I am the State Director for the Child Nutrition Program at South Carolina Department of Education. I had the unique opportunity to complete my postdoctoral studies at South Carolina Rural Health Research Center in the Arnold School of Public Health, where I gained leadership skills to reduce obesity and other chronic conditions. Thank you for the opportunity and happy 15th anniversary.
Hello everyone, my name is Eric. I'm now with China Medical University here in Taiwan as an associate professor. I did my postdoctoral fellowship in the center for about 2 years. I met Dr. Probst and Dr. Martin last year in APHA. Center folks are so friendly. It is like a big family, and Dr. Probst is like a research mom. I miss the great time with Center so much because it gave me such a memorable time of my life.
Hi, I'm Patrick Pianezza, graduate from the University of South Carolina's MHA program in 2008. I also had the distinguished pleasure of working for the South Carolina Rural Health Research Center during my time in grad school. And congratulations on the anniversary. 40 years with the Arnold School of Public Health and 15 years for the South Carolina Rural Health Research Center. That's amazing. Congratulations.
This is Jeff Atala, Assistant Professor and MPH Program Director at the Texas A&M School of Public Health, Department of Health Policy and Management. My time at the Rural Health Research Center was both illuminating and inspiring. It was illuminating because I was able to see how research is conducted effectively, and it was illuminating because I got to work with so many people at the top of their field. This has made such incredible strides in my career, and I'm so grateful for the opportunity that I had. So happy anniversary, South Carolina Rural Health Research Center, and I hope there's many more years to come.
Hi, I'm Sam Town. I'm a research assistant professor at Texas A&M's School of Public Health and an alum of the South Carolina Rural Health Research Center and the Arnold School of Public Health. The knowledge and experience gained at the Arnold School of Public Health, and especially the South Carolina Rural Health Research Center, laid a strong foundation for research, especially in health disparities, allowing me to further the knowledge base, seeking to help improve the lives of the most vulnerable populations.
Hey, I'm Will Camp, and I work for the South Carolina Department of Health and Human Services. I work for the South Carolina Rural Health Research Center for the fall of 2013 and the spring of 2014. My exposure to healthcare data and policy knowledge at the Research Center was extremely helpful in understanding the roles and responsibilities of my current job as a project coordinator at the Department of Health and Human Services.
What does the South Carolina Rural Health Research Center mean to me? Family. People I've trained, people who've trained me. All of us invested in each other for the purpose of elevating the value and the health of rural communities across our country. Congratulations on 15 years. I love you all.
Over our 15 years, we've addressed, we hope, many important problems that affect rural populations and particularly rural minority populations. We've been able to work with our faculty and students, with groups in the state of South Carolina and with groups nationally. But we realize that there is so much still to be done, and we know that the Arnold School of Public Health and our Center for Rural Health Research within the Arnold School will continue to contribute over the next 40 years, as we've hoped to have contributed over the first 40 years of the Arnold School's existence in South Carolina. Once again, I'd like to say that at the South Carolina Rural Health Research Center, we're delighted to be celebrating 15 years of trying our best to make things better for rural communities, rural healthcare institutions, and rural people here in South Carolina and across the world. Over the years, thanks to the Federal Office of Rural Health Policy, we've had core grant funding that has amounted to $9.3 million. Through the expertise we gained as part of our Federal Office of Rural Health Policy grant, we've been able to take our faculty, our students, and acquire work that will enable us to help other people, principally in the state of South Carolina, to the tune of an additional $6 million, for a grand total of nearly $16 million that we've been able to, through our skills, acquire, and with it, we hope, improve the health of rural people across South Carolina and across the nation.